love the fact that she danced with her audience.
Awesome. Awesome. We are live on Facebook and YouTube. And as you know, we're being garbled. So please call your friends, text, tag, do everything you possibly can to spread the good news. We will not have a Teacher's Pet Corner today. So if you have any questions, please type in a queue, write your questions down. For now, fasten your seatbelt because we're going to be talking to Dr. Lawrence Palevsky. So here we go. Fasten your seatbelt. It's time to get. Oh, I need to start the record. This is the stuff that you get when you watch us live. Here we go. Fasten your seatbelt. It's time to get in the moment and it's time to dance. Here we go.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here, and when you need a friend, you can count on me. I'll be right here, waiting for
you. This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful best day ever. And for those of you who are tuning into the classroom for the first time, please know we've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. As you know, when we started the classroom in 2011, it was a radio show back then, the classroom today, I started learning that I've been lied to. And as a matter of fact, since 1981, the head of the CIA, William Casey, said, we will know our disinformation program is a success when everything the American public believes, and I believe the world believes, is false. And so with that comes that we have to be programmed. We're being programmed to be told, we're told that this is good when in fact it's not good. This food is healthy when in fact it's not healthy. This shot or injection is good when we know it is not good. But once in a while, we find doctors that say, no, not here, not now. And these are the doctors that I highlight in the classroom. These are the ones that have the arrows on their back because they're leading the way. And so today is no different. We have pediatrician Dr. Lawrence Palevsky, and he's a medical doctor in New York who is helping children heal naturally, teaching parents how to look for signs, how to help raise children, which are our future, in a way that is the least damaging on their body. And if you have any questions today, please type in a queue, write your questions down, and we'll get to them hopefully we'll get to them before the end of the class today. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that holistic pediatrician, Dr. Lawrence Palevsky, is here to do just that. Welcome to the classroom, Dr. Palevsky.
Oh, thank you, Lillian. It's a pleasure to be in school again. I really enjoy it. I love the classroom.
You know what? I believe that once we get a diploma, somehow something happens to us where we stop learning, we stop growing. But I believe in being curious instead of critical. I didn't always believe that, but I do now. In the last 10 years of my life, that curiosity will help us grow and learn even more than we thought. So share a little bit about your background. You're classically trained. How did you go from a medical doctor, pediatrician that was probably giving a lot of antibiotics, giving shots, doing all these things, to a holistic pediatrician today?
Well, thank you for that. I graduated NYU School of Medicine in 1987, and I did a pediatric residency in New York at the Mount Sinai Hospital from 1987 to 1990, and then one more year of training as a fellow at the outpatient department at Bellevue Hospital at NYU School of Medicine. And I had a great medical education. I was taught by some of the leading pediatricians in New York City who'd been practicing medicine and pediatrics since the 1940s. And so everything was critical thinking, everything was differential diagnosis, everything was asking questions. We tore apart journals. We did, what are the 5 or 10 diagnoses that a kid could possibly have based on the presentation of symptoms? Did you ask the parent this? What was the physical exam? Everything was clinical. Tests were later on, tests were secondary. Everything was take a history, examine the patient, come up with your diagnosis, and then plan a treatment based on that. And so the first 9 or 10 years after I finished my training, I was an ER physician. I ran a pediatric ICU. I worked in a neonatal ICU. I did more ER. I did inpatient pediatrics, taught medical students and residents. I had my own clinic on the outside of the hospital, and I was enmeshed in Western medicine. But here's the kicker. I kept asking questions while I was told by doctors around me, stop asking questions, just do it this way. And from the time I probably was conceived, I was already the kind of person that said, wait a second, I have to ask this question, because just because you say it doesn't mean I'm going to necessarily bow down and swallow it and just accept it. And so I kept asking questions, and the more information that came to me, the more I kept asking questions. And I started to see that the questions moved me away from the way I was trained. But it didn't move me away as much as it expanded what I could possibly learn in life. Mm-hmm. And one of the things that I had to come to grips with very early on is to admit, I don't know what I don't know. And so from being an early doctor who knew everything, who was sure of himself, who browbeated parents, who told them what they needed to do, who really was hierarchical and paternalistic, little by little, I got my knees broken and I got my shins kicked, because I had to start realizing I wasn't God. There was no God complex. I didn't know everything. And oh my God, I don't know what I don't know. And I started to learn how to say, I don't know. It's sort of like the Fonz back in the 80s, 70s, when he was wrong, he would say, he couldn't spit out the word, I'm wrong. And so little by little, I expanded my knowledge base. I didn't get rid of conventional medicine. I didn't forget about conventional medicine. I just realized there was more to do than just pharmaceuticals and injections. And the world just opened up to be able to look at, well, if a child has wheezing, we can give steroids, we can give albuterol, we can give other treatments. But why don't we figure out why the wheezing occurs in the first place? Mm-hmm. And if we can figure out root cause, root contributing factor, we might actually stop this kid's asthma on a dime. And when I started to do it, because I didn't know what I didn't know, but when I started to do it, I watched kids get better. And parents would say to me, yeah, my kid got a cold, but didn't wheeze this time. And I would laugh. And the parents would say to me, why are you laughing? I'd say, because I didn't know if it would work. And they said, but you prescribed it. I said, yeah, but I didn't know if your kid would respond the way I thought he or she should. And so even to this day, over 24 years later, since I started doing a more holistic approach, when I see a kid get better and stop bedwetting and stop coughing and stop mucus production and pay attention and sit still and focus, and tonsils go down and mucus production goes down, they start speaking better, walking better, their tone gets better. When all that gets better after either changing a diet or putting them on some supplements or working with my colleagues in Chinese medicine, homeopathy, naturopathy, chiropractic, osteopathy, and others, even now when they get better, I still laugh, because it's the wonder of that discovery. Like, wow, I mean, I thought it would work, but it actually did. And you'd see this kid change and you see the parents get happier, and then they realize a whole new paradigm of well, if my kid gets sick, that actually may mean health, not something bad.
Mhm.
So it's just been a journey. And, I've been on this earth 6 decades, and I keep getting fascinated more and more. I keep remembering that the part of child development where the infant starts developing the world, a wonder of the world, is into a toddlerhood, is still part of our growth. And so I've reincorporated wonder, curiosity, fascination, discovery, observation, wow, aha moments. And I've utilized them in my personal life and in my professional life to actually thirst for more and more information and more learning and more experiences. Just like a toddler walking into a room for the first time gets, wow, for the first time. And I think we can all do it if we remember that piece of child development still resides in all of us.
I love, the older I get, and 6 decades, I'm almost there. I'm 1 year away from you. That mentality, we kind of lose it after a while. Like I said, once we get that diploma and we're told that we know everything, when you discover that you don't know what you don't know, that's when life changes. I do a workshop strictly on opening that discovery and being curious. And the next one's going to be August 26th, 27th, and 28th. So for those of you who want to join us, please feel free, go to whenyounneedafriend.com and click on that, on the I am the solution. The I am is the God in us, and solution is the acronym that gets us to connect with that God within, and be able to live that life of our dreams. So with that in mind, I love your philosophy. As I was researching you and looking at what you bring to your patients, to their patients' parents as well, that is what we're doing here. And it was so like-minded that I wanted to ask you, it seems like everything I see today, we've lowered the bar. Being sick is normal now. We don't strive for health. We maybe look at not being sick because sick seems to be the norm. Have you seen a big difference in what you're telling your patients? Because many of the parents are being told, if you get sick, you're going to die. With this virus, you're going to die. You get the virus. Oh, I got the virus. I'm going to die. That's what the mainstream media wants us to believe. Have you seen a difference since 1987 to today when it comes to what you tell your patients?
Oh, sure. I remember in the 1990s, while I was running an ICU and working in the neonatal ICU, I remember I started hearing from parents a certain pride that their child had a label, and parents would sit, because I used to teach classes in one of the hospitals where I worked, called the Toddler Club. And I remember parents talking about other mothers sitting around sharing, well, my child has asthma, my child has autism, my child has PDD, my child has cancer, my child has eczema, my child has chronic ear infections. And there was almost conversations amongst mothers shifted from, what are you feeding your child? Where'd you go this weekend? How's your mother-in-law? What's going on in your family? Oh, congratulations, you're pregnant, to pride in the diagnosis. Mm-hmm. And I started to see this groundswell of diagnoses left and right. And with that, I started to look into the numbers. And I started to see allergies were rising in astronomical percentages. Autism, which was 1 in 10,000 in 1980, is now about 1 in 34 in 2022. ADD, ADHD is now 1 in 10, right? Fatal allergies, as I said, about 12% of kids. Seizures, 1 in 20 under the age of 5 for seizures. So we're seeing cancer rates go up, autoimmune diseases go up. And the fact of the matter is that there's a robotic response to these numbers. What drug do you need? What surgery do you need? What therapy do you need? The foods you eat are no relevance.
Mhm.
Quality of air you breathe, no relevance.
Mhm.
The poisons you put on the skin, no relevance. The injections you put into the body, no relevance. The things that you listen to and watch and are absorbing through electromagnetic radiation, no relevance to your health. And so you have an increasing groundswell of parents who continue to believe that diet and environment and parenting and emotional development, psychological development, toxins in the environment have nothing to do with your health. And so people have moved towards this subservience and this almost just lying down and just accepting the status quo, sort of what you described. And they don't feel like they can do anything other than what the doctor tells them. Until they keep going round and round and round and round, and medicine against medicine and another medicine, another injection. And then they realize, I'm going nowhere. My kid's just getting worse. And what's fascinating is that there's always someone in the friends group or someone in the family unit that is doing something different.
Mm-hmm.
And that parent sort of looks to the side and says, should I ask? And many of the people in the friends group and in the parents, the parents' friends, as well as family, try not to say anything because they don't want to blast open the relationship, because, parents don't want to know that what they're doing might be hurting their kid.
Correct.
They don't want to know that the milk that they're feeding their kid is something that's creating all the mucus in their kid. They don't want to know that the shots that they're giving to their kid is actually penetrating toxic ingredients into the kid's brain and worsening the sleep and the focus and the attention and the ability to speak. So little by little, there's been this awakening to, oh my, you mean there's another way?
Mm-hmm.
And that's the wonder. That's that wow, fascination. And that's the growing learning curve, Lillian, that parents are on. It's a steep learning curve, because then they realize, oh my God, I could have done this 5 years ago. I could have done this 10 years ago. I just believed that what the doctor was telling me was 100% all that there was, and I could have been doing more. You mean my cleaning chemicals? You mean my cell phones, my Wi-Fi, my EMF? You mean the dog, the cat, the cell tower next to my house?
Mm-hmm.
You mean the non-organic food with the Roundup is hurting my kid's health? You mean these fluoride drops are creating poisonous complexes in my kid's brain? You mean there's aluminum in these shots that's reaching my kid's brain and causing inflammation? Do you mean it's possible that there's more infertility than we've ever seen because some of the ingredients that we're eating, that we're injecting, that we're breathing in, that we're putting on the skin are creating the possibility for infertility?
Mm-hmm.
You mean I can take responsibility for my health? You mean I don't have to wait for the doctor's approval? And so that's what we're seeing. And I have to say, this C19 plan is actually creating a much larger scaled awakening. And hopefully, I hate to use hopium because I don't like hopium.
Yeah.
But I'd like to think that we're moving in the direction of greater responsibility, accountability, healing, like taking, oh my God, I didn't realize that I did that. Okay, I'm not going to blame. I'm not going to criticize. I'm not going to accuse. I'm not going to sit and beat myself up. I'm going to take charge and say, well, what can I do new going into the future to change the course of my life? Because I'm not going to lose responsibility. I'm not going to give up responsibility anymore. And so, yeah, we've accepted kids not speaking. We've accepted kids at 22 years of age having 20 words or fewer. We've accepted that if the CDC says our kid doesn't need to crawl. It's not an important milestone anymore. That's okay. When I was trained, we were taught so extensively the importance of crawling and what that did for right, left, right brain development, what that did for coordination, how we were taught that an 18-month-old has 50 words and that a 2-year-old has over 100 words with 2-word phrases. And somehow we lost that as normal because so many kids were becoming anormal, out of the norm. Not abnormal, but anormal. And so we've just accepted it. And so it goes back to the 90s, excuse me, when I remember the diagnosis became a badge of honor, because that was the way parents were now relating to each other. It wasn't so much, oh, what swimsuit did you buy? Or where did you get that hat? Or, what kind of pots and pans do you use? Now it's, who's your doctor? How many therapies you go to? What drugs are you on? What injections are you getting? Are you up to date with this? How many physicians do you see, etc.? And one of the things that I do in my office is I tell parents, my job is to take away your medical license so that you don't have to medically manage your child anymore. I want to give you back your parenting so that you become a mother, a father, a grandparent, a guardian, whomever, and let me work with you to do the medical stuff. Because you've spent 3 years medically managing your kid and you haven't had any enjoyment in being a parent because you're so busy going from appointment to appointment, to the ENT, to the pulmonologist, to the allergist, to the, whatever.
Psychiatrist, psychologist.
Right.
Yeah.
So that's my job. And that's what medicine should be doing, is teaching parents how to take responsibility, how to recognize what they're doing and what they're not doing that will help the child's health and the family's health, and stop the medical management and let them enjoy their kids.
Well, there's so many things. I remember when my kids were little, Dr. Mackey, he would not allow me to talk to the nurse. If my daughter would, cough, I would pick up the phone and Dr. Mackey was on the other line. He was the one that guided me, and he was the one that used to do old-fashioned calls and became my grandpa. That's the kind of relationship I had with my doctor, with my pediatrician for my children. However, I was not given the best advice when it came to a diagnosis of ADHD or what should I do? And those are the things where doctors are saying, give the pill, give the pill, give the pill. And my registered service mark is you can take a pill, you can take responsibility. It's not that I'm against the pill. I'm just for doing other things before you take the pill, right, if it's necessary. And so with that in mind, I was told by this loving doctor, if your child gets a fever, give them something to take for taking away the fever. Now, many years later, I hear and I learned that when you have a fever, that is your body killing whatever is causing that problem in your body to begin with. We're so quick to give these medications, over-the-counter medications, that may cause harm to our children as well. So what are some of the myths that we've been told,
right,
like, if your child has a fever, make sure you give them some drops for their mouth so that the fever will go away. If they're congested, give them some over-the-counter remedy or take them to the doctor if they have an infection, antibiotics. Let's talk about some of these myths and help us discern.
So the biggest thing that I was taught in medical school and residency was, if you see a symptom, get rid of it. If you see a symptom, suppress it, because there was a moral judgment placed on symptoms. No symptoms equals health. Symptoms equals opposite of health. Right?
Yeah.
So get rid of it, suppress it. And you don't have to worry about anything. You don't have to take any responsibility We in the medical profession will provide you with all solutions so that you don't have to understand what's creating the symptom, why the symptom is there, how to alleviate the symptom safely. We're going to do that for you. And we're going to tell you that if you don't do what we're telling you, your kid will die.
Yeah.
Or your kid will be in the hospital.
Yeah. Fear.
So fear became the practice of medicine.
Mhm.
So somewhere along the line in my career, over the last 30 some odd years of being out from my residency, I started to realize that the myth that symptoms are bad, that acute illness is dangerous, needed to be undone. Because I started to learn that symptoms are merely information that your body presents you with to tell you to pay attention to what is needed from those symptoms.
Mhm.
And what I really came to understand was that an acute illness in children is the resolution of a problem, not the problem. By the time the child had the fever, cough, runny nose, vomiting, diarrhea, the body of your children were taking all of the wastes, all of the toxins, all of the impurities, and bringing them out to the surface so that your child could get rid of them. And that's why I said that the acute illness actually is the resolution of the problem, not the problem itself. And so what I saw in my practice was that if I didn't suppress the symptoms, but supported the body to complete the final evolution of the removal of the waste, toxins, and impurities, the kids got better like that.
Mm.
Right? So because I started to understand what is going on physiologically, immunologically, neurologically, gastroenterologically, that the body was experiencing. And what I realized was that if I got out of the way and supported the body to complete the process of elimination, excretion, and removal, kids got better right away.
How did you do that? How did you do that? How did you support? Because that was what we need to know. How do we support the body so that the body can heal? I don't want to use the word heal. The body can restore itself. Because I just
No, that's right. That's right. Heal is right. Ding, ding, ding.
I know, but
On the nose, on the nose.
it's a bad word in social media.
Well, but that's the difference between cure and heal,
Mhm.
right? In the conventional world, if the symptoms go away, you've cured. In the holistic world, or the larger expansiveness of understanding what is going on in the body, if you remove the symptoms, you still have the accumulation of wastes that are lingering and staying inside the body
Mhm.
until the child gets the strength and the ability to work up to the next phase of when the child can get sick, to get rid of the toxins, wastes, and impurities again. So what I realized was that, and this is rooted in Western science, it's not rooted in the practice of Western medicine, but if we dig deep enough, Lillian, it's rooted in the principles of Western science, just like it's rooted in the principles of Chinese medicine, Ayurvedic medicine, chiropractic, homeopathy, naturopathy. These principles that I'm going to tell you now are not new to all other fields of medicine. They are new to the Western culture.
Yes.
Every time we exhale, we are removing wastes. Every time we have a bowel movement, we're removing wastes. Every time our skin sweats and smells, we're removing wastes. Every time we urinate, we're removing wastes, although there is a field of medicine now that says your urine is not full of wastes, but I'm not going to go into that right now. Yeah, that's another new field.
That's getting you back to come back to talk about urine. Just that,
Yeah,
it.
And the reason we sleep, rest, take downtime, exercise, and even have primal screams is to also get rid of wastes. So the goal of the body in all of its functions is to remove impurities, wastes, toxins, and materials that inflame your body. So an illness and mucus production. Mucus is produced to bring wastes out of the body. Where do the wastes come from? Well, we breathe them. We put them in our mouth. We put them on our skin. We inject them in our skin. And we bring them into our nervous systems. So knowing that the body is supposed to discern pure material from impure material, if you're creating too many impure materials in your body, faster than your exit points can accommodate its removal, then impurities are going to increase. And when impurities increase, they cause a physiological change called inflammation. And when inflammation increases, what happens to cell function? It goes down. What happens to organ function? It goes down. And remember, the body will not die until it's ready to die. So if you have reached a threshold of too many impurities that increase inflammation in your body has to get sick in order to clean you out, because you're not doing the job by stopping what's coming in that's inflaming you. You just keep putting them in. So your body says, okay, we're going to get sick and we're going to stop you. So the answer to your question is stop putting information into the body. So one of the first things that parents say to me when their kids get sick, my kid won't eat. And I celebrate, because the body's not supposed to eat in the resolution of illness, because the body's not supposed to put more information in. It's supposed to rest more, sleep more, eat less, and do less. And so if you put a plug on the stimulation coming in, you ease the body's ability to open up the exit points to let the illness finish itself off. And so, what did grandma used to do? Turn down the lights, get into your pajamas, get under the covers, sweat it out. I'll put up the soup. I'll put up the tea. I'll put up the warm bath. I'll put a cloth on your head and we'll leave you alone. Right? But the folklore of all of that, Lillian, is no longer being passed from great-grandmother to grandmother to mother to daughter. And so who has taken the place of that valuable information? Medical world.
Yeah.
The pharmacy. And the belief and the fear that if you don't give your kid an over-the-counter medicine, something bad's going to happen.
Mm-hmm.
Right? And so how was I trained as a doctor? Don't just stand there, do something. How are mothers trained today? Don't just stand there, do something. And very, very later on, in the midst of my learning, I realized, oh, don't just do something, stand there. And that's the observation. That's the discovery. That's the wonder. That's the aha. That's the, look at that. I let my kid have this fever. I supported him or her with baths and teas and essential oils, and maybe some homeopathy and massages and quiet and liquids. And after my kid resolved the fever, he actually stood up and walked, or she started talking more. And I remember in the early 2000s, when I first started working with children with developmental delays, parents would say that their children who were non-speaking had autism or PDD, NOS, would have a fever and they'd no longer eat. And during the period that they had their fever, the kids would start talking.
Wow.
And then as soon as the kids would start eating again, they'd lose their speech. And this was well known in the community and ignored, because most people were never going to look at gut health and how it affects your brain, your lungs, your tonsils, your adenoids, your throat, your skin, your kidneys, etc. And so the answer is do less, feed less, rest more, sleep more. Pull the plug on input of information into your child. There's nothing worse than someone, whoever it is in the family, pestering the child. Are you okay? Do you need anything? Are you all right? Anything? Like, stop, leave the kid alone. Or what I noticed very early on, did the biggest trick was the parent or the guardian lying down with the kid, skin to skin. The kid would synchronize his or her breath and heart rate to the loved parent. And that would be the healing as well.
Oh, wow. That's beautiful. That's beautiful. It's, it's amazing when you, and I know that people that maybe not speak our language, maybe they're more allopathic and they believe that you need to stop the symptoms. They're hearing this for the first time going, this is nonsense. But the reality is I've seen it over and over again. Once I learned this and I started doing this for myself, because although this sounds like, okay, this is great for the child, but this is also great for the parent. And as we grow up and we evolve, and if we train the child and we teach the child, it's okay to have these moments. The body needs to break down in order to have a breakthrough, basically, is what you're saying. And so it's, if the parent starts with a child, but again, it's that fear. It's that fear of, if you don't do everything, we're going to call Child Protective Services. If you don't inject your child, which is a totally different, back in 2015, I became aware of it, of what's happening. My children are grown now. They didn't have the 70, 80 shots. But now these kids, if you don't do it, you're shamed. I had a pediatrician come on my radio show at the time and say, any parent that chooses to not inject their child, they're escorted from my clinic. He never came on again. At that point, you start. It's that curiosity. Okay, what happened when my kids were little? It was 1 in 10,000 that would be with a diagnosis that had a neurological or some form of dysfunction. 1 in 10, and now it's 1 in 2. Did you say 1 in 10 instead of 1 in 10,000? It's ridiculous, and nobody is stopping to saying, what is causing this? And so before we continue, I just want to remind you guys to go to whenyouneedafriend.com. This is where we have these conversations. Dr. Palevsky is not the first one that has talked about this. We've had shows that are being taken off, classes that are being taken off by Dr. Andrew Wakefield, Del Bigtree, Dr. Lorraine Day. I mean, they're being removed from 2017 when it was okay to talk about injections. Now it's not okay. And so I want to encourage you to go to whenyouneedafriend.com. Please become a subscriber, because the class is now being aired on my website. So if you don't want to be on YouTube or you don't want to be on Facebook, we're working on whenyouneedafriend.com. So please subscribe so that you get notifications when we're on. And you'll know who is the teacher in the classroom. Like today, if you want to get a hold of Dr. Palevsky, all you have to do is go to the blog, click on his name, and it'll take you to drpalevsky.com. And so this is how we work together to share this information, because you're not going to get it in the mainstream media. So I want to encourage you to not only subscribe, but like me and follow me on social media. Also check out the different workshops that we're doing. The I Am the Solution will help you become a critical thinker, a curious thinker, instead of a critical thinking, as opposed to being critical. which is what is the MO right now. If you don't believe like I do, I'm going to cancel you. So let's step into something different and new so that you'll be open to these things that we will need in the future, because we may not have access to good food or good medicine that is needed, but it's good because the body will restore itself. So go check out at whenyounneedafriend.com, my sponsors, support them the way that they're supporting the classroom. Go check out my Shop Now bag. Dr. Palevsky has said many times about the stuff on the skin, and we have Keep Me Safe Organics, 100% organic, no chemicals, no synthetics. And those are things that I use on my skin head to toe, and my grandbabies come over, they do too. You know, there's not much I can do with my children. They grew up a certain way, and they're believing what they're being told. But one step at a time, do whatever you can to help minimize the risk. And finally, check out all the Shop Now bag. All the things are Lilly approved, and they're healthy, alternative, holistic, natural. And last but not least, you can become a enrolled student in the classroom, and you can give, whether it's $1 or $1,000 of your time, your talent, your treasure once a month, or a one-time donation. Anything will help. So please consider donating to the classroom as well. Today we have Dr. Lawrence Palevsky, who is a holistic pediatrician in New York, and you can find him at drpalevsky.com. Or you can go to Northport Wellness Center and check him out there. Now, Dr. Palevsky, do you do telemedicine, or how can people take advantage of your knowledge and your years of wisdom? Can anybody go to you outside of New York?
Okay, so thank you for that, Lillian. I am not doing telemedicine at this time, other than with families in my practice who I already know, who have moved to other states or even other countries.
Yes.
I realize the demand that's there, and I feel horrible that I'm not 30,000 people. I'm only one. But I also know that there's a lot of information on my website, tons in my newsletters, lots of videos that I've done, interviews that I've done on health and healing, on shots and injections, on critically thinking, on parenting, on nutrition, safe ways to support your child through an illness. And I am in the process of planning greater projects.
I have no doubt.
I can't talk about, I'm not talking about, I don't like to jinx things, but I do travel and teach. So I will have a couple of events coming up in October that people can know about, that'll be on my newsletters, and some in Minnesota, some in Michigan, a couple in Chicago, and one in Tampa. So there will be things happening. There's something that you said that I'd like to go back to, if you don't mind.
No.
You said that there are going to be parents who listen to this and say, forget it, I don't believe it, there's nothing right about what he's saying. And I want to say that I'm 100% okay with that.
Me too. Yeah.
And the reason I'm okay with that is because I didn't always look at it as I'm okay with that.
Mhm.
Because as the doctor, I had to go in and persuade and convince and influence and browbeat, just like that doctor who says any patient in my practice who doesn't give their kid the injection is escorted out, right? That's not medicine. That's tyranny.
That's right.
And so when I was trained, the pediatricians taught us an unbelievable mantra. Always listen to the mother. She's the one who knows her child the best. And I'll tell you that I lost sight of that in part of my, life, part of my practice. And I had learned, and still learning, how to recapture that and understand that I'm only getting a small little snapshot in a 50 million frame film of a child when the parent is there for every frame, just about. And so when the pediatrician says you will be escorted out because you don't know anything, we're not practicing medicine anymore. we're practicing tyranny because there's no exchange, there's no relationship anymore. And a relationship means that I get to say what I have to say, you get to say what you have to say, and I get to say whether what you said works for me or not, and you get to say whether what I said works for you or not, right? It's a similar thing like, honey, can you come in here in a minute? I need you. All right, honey, I know you need me. I'll be right there. Give me a second. I'm in the middle of something. That's relationship.
Mhm.
That's relationship where you respect what someone else needs from you, but you also take into consideration that you have needs and vice versa. We've lost that, not only in Western medicine, but we've lost that in the world's culture,
Mhm.
right? So I
Yes.
could look at a mother and say, you know what? I'm okay that you believe that I'm full of it. I said, but the thing is that I have so many years of experience that I've watched this work. And if you're not curious, that's okay. I know that my job as a physician is to give you the information that's based on my experience so that you can never say you didn't hear it.
Mhm.
And you can tuck it away, shove it under the rug and say, this guy's an idiot. And I'm okay with that. I'm not okay with you disrespecting me. And I have in the office said, you don't have to agree with me, but I don't appreciate you speaking to me that way.
Great.
And I'm totally okay if a parent looks at me and says, I don't appreciate the way you're speaking, because I'm willing to self-correct. But the thing is that we have lost informed consent. We have lost dialogue. We have lost debate. We have lost holding the space for opposite or dissimilar viewpoints and still maintain love, respect, and honor.
Mm.
And we've lost that. So we're not practicing relationship anymore, Lillian. We're practicing tyranny.
Well
We're
said.
practicing entitlement. And you need to do it the way I do. Otherwise, you're racist, discriminatory, or a bigot.
Mhm. Name
that?
calling. Yeah.
Right. Right.
Yeah. When
And-
all else fails, when reason fails, let's just call names. Let's go for the gut or the knee or the kneecap, or let's hit you where it hurts. And I will say, when I hear you saying all these things, when I was younger, raising my children, I was not open. I did not know that food would make a difference. I did not know that emotions, children today, when I interviewed Bruce Lipton, that changed my life. That interview started me thinking like, what? I can take responsibility for my life, my thoughts, and my emotions. And now that's my mission in life with my workshops and everything that we do. We're doing a body code with Dr. Bradley Nelson coming up soon in November. That's what I dedicate myself. But I remember being the one saying, crap, I don't believe that. I don't believe that. It wasn't until I was given this gift of the radio show, turned now into a classroom, that I began. God said to me, the only way you're going to learn this stuff is if you just die to self and start learning and be curious about these things. And when I'm criticized and I'm called names, which I am many times, I laugh because I'm reaping what I sowed. And I know that this is a time in my life where when I could see myself in them, and I forgive myself for being that way.
Right.
It's so important that we be gentle on ourselves. Perhaps maybe we made some choices for our children that now we need to forgive ourselves for and say, I did the best I could with the information I had. There was no informed choice. It was take the child, inject them. At the time, I don't even know if my child received a shot when they were born. I did not even know they were doing it.
Mm-hmm.
So now today, if people don't know, with the rise in all these childhood diseases, even cancer, but we're still a victim. So that's how they're able to cause fear and the tyranny to make us do what we don't want to do. Instinctively, we know what we need to do, but that has been programmed to be given away, like our power given away. So what would you say, because I want to make sure that I'm trying to see if there's any cues, but what would you say to someone? Because I know that if you're not ready to hear this, you're not ready to hear it. And I'm okay with it because I need to be okay with it. I can't do anything. I'm powerless. So what is your advice to someone who has children or grandchildren that are not open to this? How do you sit back and say, well, it's their life, it's their child's life, and you're seeing, children today on their phones at the age of 3 or 1. What would you say to a parent that may be curious right now as to how harmful that is for their child?
Okay. Well, that's a lot.
I know.
5 minutes, that's a lot. Well, first of all, I really appreciate what you just said as a mother who had her comeuppance, because you know that the last thing you want to know is that you harmed your children.
Correct.
And you know that the last thing you want to know is that you didn't know. And why didn't somebody tell you?
Mm-hmm.
And you know that the last thing you want to know is that the person in whom you trusted the lives of your children, you may have given such devotion to that you blindly accepted what that person said
Mm-hmm.
and may have hurt your children.
Mm-hmm.
So you have to get to the level of anger and the level of pain and the level of disappointment that allows you to heal that, so that you can go to what I'm going to talk about now, which is there are 3 ways in which we know things. One is intuition. Somebody says something, you see something, you hear something, you think something, and you do a check-in. And you go in and say to yourself, does this sound right? Does this look right? Does this feel right? Is this true? That's a huge piece of knowledge. And as a woman, it's much greater in the woman than it is in the man. Although I want to give kudos to men who are gaining in their intuitive power. The second way you know things is because you experienced it yourself. You toiled, you researched, you thought it through, you trialed, you erred, you owned it because you had the experience. No one can take it away from you. And so people could say to me, I'm wrong if taking dairy away from a kid helped the bedwetting, when I've seen it hundreds and if not thousands of times work. They can tell me I'm wrong, but nobody can take away my experience, which fed my knowledge.
Mm-hmm.
And the third way of knowing things is based on what people tell you is right. And so my advice to anyone who's open is pay attention to 1 and 2, because we've lost it. We've lost our checking in to our intuition. We've lost doing our own research, trial and erroring, and figuring things out for ourselves so that we have ownership of our knowledge. So we've critically thought through something. So we've become empowered to know instead of depending on, well, my doctor said. Well, did you question your doctor? No. Well, do you want to question your doctor? No, there's no reason to. And that's where we are. That's where we are with media. That's where we are with cell phones. That's where we are with iPads, computers, video games, medicine, injections, etc. And we're at a critical juncture in the consciousness of mankind to actually shift.
And you're absolutely right. Thank you so much. And when we're in fear, we lose that ability for 1 and 2. we lose that ability. So fear no more. Thank you so much, Dr. Palevsky, for your time here today. Please remember that you can reach out to Dr. Palevsky at drpalevsky.com. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Palevsky wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Thank you for watching today. Please remember to go to Dr. Palevsky's site. You can go to whenyouneedafriend.com. His information's there as well. Thank you, Dr. Palevsky, for coming into the classroom and sharing your wisdom. I know this will be the first of many. Thank you so much.
Thank you, Lillian. It was a pleasure. It was great getting to know you and sharing in our conversation. Thank you.
Absolutely. We've got more. This was just a dip in the toe of in the river of life. So thank you so much for watching.